Hello, I'm Esme Fuller Thompson. I'm the director of the Institute for Life Course and Aging. We are absolutely delighted today to have Dr. Barry Goldlist with us. He's a professor of medicine at the University of Toronto and a staff physician at Mount Sinai Hospital and the University Health Network Department of Medicine here in Toronto. He is also a longtime friend of the Institute for Life Course and Aging. So Dr. Goldlist, one of the most important questions I hear regularly is, I forget names. What does this mean?
Everything starts in a modest way, but the vast majority of people who can't remember names, there's nothing wrong with them. And I give them 3 tips for saying what could be normal. And normal is one that you should know the name, and so it's bugging you. Number 2 is that you know the context. How could I forget the name? I worked with him for 10 years. And then number 3, it eventually comes back. It might be the next day, but eventually it comes back. And I suspect that even younger people have problems at times remembering names, but it doesn't concern them because they know they're not developing Alzheimer's disease at 25. So it's only older people who are concerned with this, but it can be totally normal. And as I said, if you meet those 3 criteria, don't worry for now.
Okay.
It's only when you have problems with day-to-day function that you have to really start worrying.
Could you go over what some of the differences are between age-related memory impairment and dementia?
I think the major thing is in dementia, you lose the ability to function in certain ways. Whereas people who have age-related memory decline, really they might have trouble remembering details as well as they did before, but it doesn't affect their function. And there was an interesting study many years ago having a detailed newspaper article read by young people and old people, and none of whom were cognitively impaired. Young people remembered more of the details of the article, but older people actually got the point of the article and the underlying principle much better than younger people. So I think rather than saying that our memory gets worse with age, it's just that our approach to data changes with age.
Are there any ways that we can decrease our risk of developing dementia?
I think we should look at the development of dementia in old age as part of your entire life course development. And that's why the Institute has the name it has, because what happens prenatally will affect whether you have dementia in old age or not. We know that premature birth, poor nutrition by the mother during pregnancy, those will cause vascular problems, which increase likelihood of dementia later in life. So it starts off that the latest edition of the Journal of Neurology shows that enriched cognitive activities in early childhood are a predictor of dementia or lack of dementia later on in life. So reading to children, getting them to read, getting them to do activities that use their brain is going to be important when they're 80 years old as well. And then in younger and midlife, the things are mostly focused on preventing vascular risk factors. And that means healthy diet, lots of physical exercise, and control of high blood pressure, control of high cholesterol. If you have an arrhythmia of the heart, might need anticoagulants, that would be a factor as well. So it's the things that the cardiologists have been telling us now for decades on how to prevent a heart attack are also effective in preventing dementia in later life, because dementia can be caused by vascular problems in the brain, but there's a relationship between vascular problems in the brain and Alzheimer's tendencies as well. So they very commonly go together. So you can really decrease the load of dementia by decreasing vascular risk factors, and that goes on into old life as well.
If we're experiencing memory loss, are there some tricks or strategies that we can use to cope and manage better living in the community?
Definitely. So I think the first thing is to figure out why there's a memory loss, because sometimes there are other issues besides something wrong with the brain that can do it. And that, you can't remember things if you don't pay attention. And there are tons of drugs and medications that can cause that. So I think the first thing, if you're suspecting that your memory is not as good as it was, is to be reviewed by your physician. And if you're sick in any way, forgetting about the medications, that will detract from your ability to attend to information and pay attention, and therefore you can't remember if you don't pay attention. So I think the first thing is your general health, and then the medication review. Those are very, very important in deciding why your memory isn't feeling good. As far if there is truly something going on that's impairing memory, there are two strategies. One, can we prevent future memory loss? And then the other is, how can we organize our lives so that we can overcome the memory problem? And the only thing that we're really confident about right now that will slow down the progression of any memory loss, regardless of what caused it, is increasing physical activity. There has been stuff about, using your brain as well. There's not as much evidence that is effective in slowing down any memory loss as is physical activity. However, it can't be harmful, and if you pick a cognitive activity that you enjoy, it's killing two birds with one stone. So we recommend that as well. But I think the real key in trying to slow down any memory loss is increasing your physical activity. There was a study in the 80s and 90s which resulted in a textbook on the MacArthur study of successful aging. And basically what they said is it's never too late to start exercise, but the earlier the better. And any amount is better than nothing, but the more the better. And so walking is good. There is something about some resistance exercise and enough exercise to raise your heart rate and make you sweat that probably is better. And before you do that, obviously you need to get a checkup from your doctor to make sure that there's no danger in that. For those who have enough resources and finances, when I started off in medicine, personal trainers would refuse to see an older person. Now they realize that's where their business is located. So physiotherapists and personal trainers are well versed in what are successful ways to increase activity in older people, and also in how to motivate them. Because saying exercise more is easy, motivating yourself or motivating others to actually do it is a lot more difficult.
Are you noting any increase in people coming in with memory problems prompted by distress and disorganization and the upheaval around the pandemic?
Not particularly with the memory part, but certainly with the function part. Because once you get out of your routine, even if you have minor memory problems, it's hard to adapt at times. And so a lot of our memory aids are the people we deal with. And, I always tell the residents, one of my favorite studies of all time was a Danish study from about 30 years ago, that looked at housebound elderly people who lived alone. And the intervention was regular care versus the intervention of a friendly volunteer calling once a week. And over the following year, the phone calls from a volunteer resulted in fewer deaths and fewer hospitalizations. We don't know, it's a black box. We don't know what changed. But to me, the message I drew from that is we're not meant to be hermits, is that social interaction is essential for quality of life. And that's been really devastated, during this. Even for myself, not being able to hug my grandchildren. We had a temporary bubble before they went back to school, and that's been burst again. So I can no longer do that. And that's really distressing. And you can understand remember, sometimes cognitive problems are more than just memory, something we call executive function, where you can put things in context of the whole broader world can be damaged as well. And you can't overcome that loss of social contact easily. And if you're not technologically good with Zoom and other things, then you don't even have that kind of contact that some of us do. I would say that for those who are a little bit more technological savvy as grandparents, I've been taught by my son, who before he became a school teacher was in IT, is that for grandchildren of a certain age, electronic games played over the internet. So I have grandsons in Vancouver, and we play various games over the internet, because sitting down and having a talk with a 10-year-old is not all that fulfilling. But you get a lot of comments and a lot of interaction when you're playing an electronic game. So that's something to consider for breaking the isolation. It certainly worked for our family.
Do you have any suggestions or strategies that we as caregivers can use for older adults with memory problems?
I think there are, the first thing is that they're not, let's say it's your spouse, is not trying to cause trouble for you. If they honestly can't remember, confronting them, accusing them of not doing something is not going to help. So setting up the organization, the calendar on the fridge or something like that is a much more important way to do it. And fighting over things is going to be counterproductive, because one of the other things that changes can be your mood or personality. If the brain is being damaged, you can become depressed, upset, irritable, and those are difficult things to manage. And the last thing you want are confrontations. So you don't have to win every fight with your spouse whose memory is failing. Agreeing to disagree and saying, okay, we'll do it your way is fine at times. These things that when you have a personal 50-year commitment to the person, the changes can be very upsetting and very difficult. If you're going to hospital clinics, most of the hospitals now have patient portals so that you know exactly what the doctors are saying in case you forgot at the time, because doctor's appointments can be stressful. And so it'd be very worthwhile to get power of attorney if you don't feel that the person you're giving care to is capable of using the portal and understanding it, is getting power of attorney for healthcare so that you have access to the portal and can keep up to date in all the things that the doctors are saying. Because many older people have numerous specialists and subspecialists that they're seeing, and trying to keep track of it can be very difficult.
Are there any particularly helpful resources you'd like to suggest for people who want to learn more about how to manage memory loss?
The best resource from what I've seen for the general public is, if you do have technological ability, is to visit the Alzheimer's Society website. They have numerous modules on education for caregivers, etc., so that they're an absolutely invaluable resource to the caregivers. At Mount Sinai Hospital, we have an incredible resource called the Reitman Center for education of caregivers, and that is an incredible resource. It's been shown in randomized trials that social work intervention educating family members, caregivers, will decrease the likelihood of having to go into a long-term care facility. So it's a win-win for the patient, win for the family, and win for the healthcare system, because long-term care facilities are expensive and not necessarily the highest place for quality of life in comparison to your own home. I can't stress, though, how important it is for an older person to have a family doctor to be providing the overall stewardship of the care. If you have too many specialists trying to control things, then you often get contradictory or even harmful contradictions in care. So you really need a family doctor. The older you get, the more important having a reliable family doctor becomes.
Thank you so much, Dr. Goldlist. As always, it's informative, and it's been such a pleasure to speak with you today.
Thank you, and it's an honor to be involved.